Welcome to this tour of the Casa Colina Hospital Medical Surgical Wing. Opened in 2016, this part of Casa Colina's extensive continuum of services has been designed to help physicians, surgeons, and the medical team provide the best medical and surgical care and make that available to the community. Casa Colina recognizes the individuality and dignity of every patient and is dedicated to patient care and respect for every person we serve. The outdoor gardens and visitors' lounge offer incoming patients and families a convenient, restful place to gather. And a separate conference room allows physicians and families a private place for conversations about a loved one's medical status. Surgery patients enter here to go to the preoperative unit. To the right is a fully equipped gastrointestinal procedure room. This hallway allows patients immediate access to Casa Colina's full-service diagnostic imaging center. The preoperative unit has 6 bays. This is where surgeons, anesthesiologists, nurses, and support staff work with each patient to ensure that they are ready for their surgical procedure. Leaving the preoperative area, we come into the sterile environment of the surgical suites. This spacious surgery suite allows surgeons and staff the freedom to use large equipment, such as robotics. And the master monitor screen allows surgeons to display images such as CT and MRI scans, as well as all of the physical monitoring of patients, shown in real time. An important feature of this system is that the presentation of information is entirely flexible. It can be configured to suit the needs of a particular operation and the personal preferences of each surgeon and team. The latest technology is built into the lighting boom. A computer-controlled camera is part of the interactive capabilities of the room. The camera is complemented by a connectivity screen that can show images from the camera, from collaborating facilities, and from consulting specialists who may be watching at any location in the country or the world. The second surgery suite. It has the same monitoring and connectivity technologies, including the master screen display. All surgical suites accommodate complex orthopedic procedures, such as total hip and total knee replacements, and neurosurgical procedures, including spinal fusions and laminectomies. The third surgery suite, nearly a mirror image of the first. It's equipped with the same advanced monitoring and connectivity technology. These surgical suites were designed with the input of surgeons and accommodate technology such as the Mako orthopedic robot, resulting in less post-operative pain, shorter hospital stays, and better outcomes. Robotic surgery is a technology that will be used here, but what will come next? The open design and ease of access mean that we'll be able to accommodate new technologies as they are developed. Next to the surgical suites is the post-operative recovery area, with 6 bays, of which 2 are in separate rooms. Adjacent to the surgical department is a 6-bed intensive care unit, the ICU. These are very large rooms for an ICU, built to accommodate easy movement of staff and visitors. The head wall was a critical design issue. It combines ports for full telemetry, monitoring, oxygen, and communications. And nurses have observation stations for each room to see for themselves the status of each patient without interfering with sleep or private conversations. All the rooms are furnished with comfortable chairs for visitors as well as sleeper beds for a loved one to spend the night. Every room also has a patient lift system to help move patients without injuries to them or staff. and to give patients the earliest possible access to a normal hygiene routine. To promote this, each room also has a private bathroom. From the ICU, most patients will transition to the medical surgical unit on the second floor. This is the central nursing station for the medical, surgical, and telemetry patient rooms. There are 25 patient rooms on this floor, for a total of 31 beds in the medical surgical wing. All are appointed and equipped at a high level of connectivity and comfort, with attention paid to the smallest details to make a patient's stay more pleasant. Each room has the same lift system to help assist and encourage patient mobility. By design, all these mechanics are out of sight in cabinetry when not in use, leaving the room more uncluttered and restful for patients and families. These are all private rooms, generous in size, with telemetry at 15 beds and Wi-Fi for patients' use. They are also furnished with comfortable chairs for visitors, and each room has a full bathroom, including a shower. Some rooms have extra design features in addition. One of these is the bariatric room, made to accommodate persons who have special accessibility needs. Also, the 2 isolation rooms with negative airflow and closer monitoring to control infection. Attention to detail and promoting the best recovery for every patient is built into the design. We also know that it's not the physical surroundings that are most important, but the personal care and quality of the clinical service that our staff provides to our patients. That's our daily focus and the commitment of everyone at Casa Colina.